Welcome back to Make Your Life Healthy. On this segment of our program, we're going to be talking about diet. You know, I am a diet dropout. Most of my life, or at least my adult life, I've battled the bulge. And I've gone from one diet to another. I've tried them. I've gained weight back. I've lost weight. I've probably lost 2,000 pounds, but I've gained it all back in 5-pound increments. So over that course of time, I have found out that there are a lot of different diets that don't work for me. I even concocted some of my own. For instance, did you know that there's a eat all the pizza that you want diet? Or how about the chocolate at every meal diet? Anything that I could do to try to lose weight, I would do. So when I found out at the beginning of this year that there was a new diet in town, I decided I wanted no part of it. I know what I have to do in order to lose weight. It's a matter of whether I do it or not. So I really wasn't interested. But then I started hearing more about it, and I decided that I was going to do some research about this new diet and find out what it was. I was very excited about it and enthused about it, and in order to give you that same information, I've invited with us today Dr. Dan Buchanan, and he's come along to share this information with you. So welcome to our program, Dan.
Thank you.
I would just like to know how you decided to bring this diet to Cincinnati and what's so unique about the UniqueU Medical Weight Loss program.
Well, I learned about this diet or this program a couple of years ago at a seminar I attended in Florida. It really got my attention as making sense from a medical and scientific point of view, and I began to talk about it with my partner, Dr. Jim Lutz, who has experience in weight loss programs. He was the head of one of the local hospital weight loss programs for years. So he began to think it over, and we thought that this would be a great thing to do. We began to research it, and there was not a lot of it here in the Midwest. What is really unique about this program is the use of a hormone called HCG.
What in the world is HCG?
HCG is a hormone that women develop when they become pregnant. One of the things HCG does is if a mother were to go into a starvation state, either on purpose or by accident, HCG is going to mobilize or begin to use a mother's stored fat to feed the fetus. That's why sometimes we see in these third world countries, we might see on TV a bone-thin, emaciated mother giving birth to 7 or 8 or even 9-pound babies. It's because of HCG.
Oh, how interesting. So what does that got to do with us dieting?
Well, it does the same thing in non-pregnant people, even men. So if we give patients HCG in a combination with a low-calorie diet, it's the low calories that cause the patient to lose weight, but the HCG causes what type of weight to be lost.
Oh, that's interesting.
Yeah.
So how is that integrated into a diet program?
Well, with a combination of diet, exercise, nutrition, we also use prescription appetite suppressants, HCG, and a combination of education. With all those factors, patients are much more successful or able to be successful with permanent weight loss.
Does HCG have any side effects?
In men, there are none. In women, there's occasional menstrual spotting. But if a female patient spots, we change the dose and that goes away.
Are there any after effects of it after you go off of the HCG?
No real after effects with the exception of a high metabolism. So with only fat loss, because remember with the use of HCG, we only lose fat. The diet takes the weight off, but the HCG determines what type of weight. So metabolism floats with lean body mass. So the more lean body mass we have, the higher our metabolism. So once our patients reach their weight loss goal, because they've only lost fat, their metabolism is much, much higher than when they began with us. So the lasting effect is a high metabolism.
Well, you know, one of the things I've seen since I've been on the diet is I've consistently lost weight. And sometimes it's only a little bit a week, but I've lost weight every single week, which is really unusual for me on any diet program because typically in the past I have been on whatever, and after 2 or 3 weeks then I don't lose anything. So then I'm frustrated, or I'll go back and I've lost 3 ounces, you know, and I've starved myself all week. So I hated those kind of diets, and I've been consistently losing on this, which I've been impressed with that fact that I do continue to lose. But after I'm off of this, am I going to have that yo-yo effect again? Even if I'm eating more calories, am I, you know, going to have to really take into account carbs or fats or anything like that?
We're going to give you a recommendation on breakdowns of proteins, carbs, and fats.
Okay.
but it's all going to come down to that range.
All right.
And it's going to be an easy range because it's going to be high. So there's no reason that the weight should come back on as long as we stick to the range.
And as long as I keep exercising and keep my body healthy with other things that I'm doing.
Absolutely.
Okay, so the HCG plays a big part in it, and there's a lot of HCG I've noticed in doing research on it. On the internet, you can go on and buy HCG that's supposed to be homeopathic. That is not recommended because all real HCG requires a diet or a doctor's prescription in order to get it. So if you're buying it on the internet, it's either black market drugs or it's not the real thing. So be very cautious if you're thinking that in your minds that you can go on and get this. You need to go see a real medical doctor. You need to get a prescription for the HCG that you're using and make sure it's the real thing. Is there any other thing we need to know about this?
Well, about HCG in general, I completely agree with you. If you're not under a physician's supervision, I don't know what they give on the internet or what they sell. I've had patients who have been on that who now are treating with us, and they've brought it in, and I can't say for sure what it is. Dr. Lutz is the medical doctor in our practice, and he does all the prescriptions for our prescription grade HCG. But that is, it could very well be dangerous taking whatever that patients get over the internet.
Okay. Well, I know that for me it has worked. It's been a great diet for me. It has not been difficult to stick to it, and I'm very happy with the weight loss that I've had. So I'm planning on reaching my goal, and I know that if I do and I stay on target, I will be able to go back to eating the healthy things that are on the food pyramid and staying away from the fast foods that are not supposed to be in my diet. I really appreciate you coming on today, and I thank you for being here and being a part of our new show.
Thank you for having me.
Thank you.